Hello everyone, I'm Anas Al-Ubaidi, and the topic or the title for this session or lecture is Healthcare Law and Policy Impact on Administration, and it is within the chapter that covers the foundations of excellence in healthcare administration, and it is within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Healthcare law and policy play a critical role in shaping every aspect of medical field, from patient interactions to the management of a healthcare facility. For administrative medical assistants, understanding these laws and policies is not just an added skill, it is an indispensable part of their role. These regulations dictate how patient care is delivered, documented, and billed, ensuring compliance with federal and state requirements while protecting patient rights. Key points. Compliance requirements in healthcare administration. Healthcare administrators are tasked with ensuring compliance with federal, state, and local laws. These include policies related to patient rights, workforce conduct, and financial management. HIPAA compliance, as in USA we have HIPAA. Anything relevant to HIPAA or similar in another geographical areas, example in EU, European Union, we have a GDPR. HIPAA strictly regulates how patient health information, PHI for short, is shared and stored. In other words, administrative staff must ensure that patients sign consent forms prior to disclosing their records and verify that digital files are encrypted to prevent unauthorized access. Training staff regularly on HIPAA updates is key. The Affordable Care Act, ACA. The ACA, the Affordable Care Act, structured healthcare policies requiring facilities to meet specific quality metrics for reimbursement. In other words, regular quality assessments and accompanying documentation are now necessary to avoid denial of payments under value-based care programs. False Claims Act, FCA for short, False Claim Act, penalizes fraudulent billing practices or fraudulent billing practices, frauds. Administrative staff must verify every claim submitted complies with billing codes and supporting documentation to prevent unintentional fraud. And here is a diagram on navigating healthcare compliance. Healthcare compliance, we have HIPAA compliance, ACA compliance, FCA compliance. Another key point here, privacy laws and patient confidentiality. Protecting patient confidentiality goes beyond restricting information access. It involves routine audits and security protocols. Data security standards. Staff must secure electronic health records, EHRs, with encryption and multi-factor authentication. Breaches of patient data can result in hefty fines and the loss of patient trust. In other words, i.e., many organizations now use cybersecurity software and simulated hacking exercises to identify vulnerabilities. Minor consent laws, policies determining whether minors can receive care without parental approval greatly impact administrative documentation, i.e., maintaining records separately for confidential services ensures compliance with state laws. And here is a diagram on patient confidentiality strategies, data security standards, minor consent laws. Another key point here, we have billing regulatory frameworks. Billing is one of the most legally regulated aspects of healthcare administration. From coding accuracy to claim submission, adhering to billing regulations ensures financial transparency. ICD-10 and CPT codes, medical coding systems like the International Classification of Diseases, ICD-10, translate diagnoses into uh, billable services. Administrative assistants must ensure these codes align correctly with the services rendered to avoid denials. Medicare and Medicaid specifics. Reimbursement policies often change annually, i.e., procedures that qualified for reimbursement one year may not qualify the next. Staying updated on CMS guidelines is critical uh, to operational billing. Auditing reimbursement adjustments. When audits are conducted, administrators must have precise documentation to justify payments received or argue against repayment demands from insurers. Another key point here, practice management adjustments due to legislative changes. Healthcare laws regularly adapt to reflect current industry needs. Practice management must integrate these changes swiftly to remain compliant. Telehealth provisions, recent policy expansions under the CARES Act have included telemedicine reimbursements. Administrators must now which platforms comply with privacy laws and understand billing regulations for telehealth visits. Employment laws and in healthcare, policies like workplace harassment regulations and overtime requirements directly affect how shifts are scheduled and documented, ensuring the organization follows fair labor practices. And here is a diagram on healthcare regulations, telehealth provisions, and employment laws. Consequences of noncompliance. Now, failing to adhere to laws and policies can result in severe penalties, including financial uh, repercussions, lawsuits, and reputational damage. Civil penalties, i.e., a failure to file claims correctly under the FCA, carries fines of up to $23,000 per claim, significantly impacting the organization's revenue. Litigation risks. Patients or regulatory bodies can sue for breaches in patient privacy or improper billing practices. Documentation audits and staff accountability programs are essential to mitigate these risks. And here is a diagram on non-compliance leads to severe penalties and financial loss. Then we have the application examples here. For instance, managing HIPAA compliance audit scenario, healthcare facility is informed that it will undergo a HIPAA compliance audit requiring proof of adherence to patient privacy laws and security standards. The stakes are high as failing the audit could result in hefty fines and loss of trust. Steps taken by CMAA, Certified Medical Administrative Assistant, organize all necessary documentation, including patient consent forms, access logs, and data sharing policies. Conduct a rapid review of staff compliance training records to verify that training is up to date for employees. Use compliance software to perform an internal audit and identify any vulnerabilities in the system. Rectify discrepancies such as incomplete logs or inadequate encryption measures before the official audit begins. Prepare a comprehensive report detailing compliance procedures and results to present during the audit. Resources needed. Compliance management software, encryption and IT security tools, HIPAA training programs, and documentation management systems. The impact here, by proactively addressing vulnerabilities and staying prepared, the CMAA ensures the facility avoids penalties, reassures patients about the security of their data, and instills confidence in regulatory authorities. Another application example, ensuring correct Medicare billing. Scenario, a rejected Medicare claim for a high-cost procedure reveals discrepancies in billing codes and supporting documentation. The delay threatens the revenue stream and patient satisfaction. Steps taken by CMAA: retrieve the denied claim and review it against coding guidelines to identify errors or missing documentation. Confer with the healthcare provider to clarify the services rendered. Correctly apply updated ICD-10 and CPT codes, ensuring accuracy and alignment with the service provided. Resubmit the claim to Medicare alongside clear documentation, including patient records and provider notes. Monitor the reimbursement resubmission. Monitor the resubmission process and follow up if delays persist. Resources needed: updated ICD-10/CPT coding guides, EHR systems with integrated billing modules, claims resubmission trackers. Impact here: accurate Medicare billing not only avoids financial loss from claim denials, but also ensures patients are not erroneously charged, maintaining trust and operational efficiency. Another application example: implementing telehealth billing under new policies. Scenario here: a facility begins offering telehealth services but struggles to manage billing for these visits due to new CMS reimbursement rules. Patients also face confusion over costs. Steps taken by CMAA: review the latest telehealth billing guidelines issued by CMS to understand reimbursable services, organize staff training sessions to familiarize providers with telehealth specific billing codes and documentation requirements, update the EHR system to include telehealth visit templates, and ensure secure communication platforms for remote consultation. Communicate clearly with patients about telehealth charges and insurance reimbursement potential using patient friendly materials. Conduct post-implementation audits to verify accuracy in billing and address patient feedback. Resources needed: CMS telehealth policy guidelines, EHR software with telehealth integration, patient billing communication templates. The impact here: efficient telehealth billing increases revenue potential, reduces patient confusion, and positions the facility as adaptable to modern care delivery modalities. Addressing data breaches. Scenario: a data breach in the facility's service compromises patient health records, resulting in HIPAA violations and reputational damage. Steps taken by CMAA: immediately notify affected patients of the breach following HIPAA breach notification rules, coordinate with IT to secure the breached area and prevent further unauthorized access, implement staff retraining on data protection protocols to minimize human error risks, conduct a full audit of system vulnerabilities, and invest in advanced cybersecurity measures. Work with legal advisors to address compliance issues and avoid reputational damage through transparency. Resources needed: incident response software, cybersecurity tools like firewalls and encryption, HIPAA breach response templates. Impact: swift action minimizes the impact of the breach, safeguards remaining data, and demonstrates the facility's commitment to patient privacy, recovering trust. Another application example: adjusting operations for payment methods. Scenario: new healthcare laws shift the reimbursement model from volume-based services to value-based care, affecting the facility's revenue cycle. Steps taken by CMAA: analyze quality metrics and identify areas where patient outcomes need improvement. Collaborate with providers to document care measures that influence reimbursement, in other words, follow-up visits, rates, or patient satisfaction scores. Implement incentive programs for staff to enhance patient engagement and satisfaction, such as educational initiatives. Update documentation processes to comply with quality requirements, ensuring all services are tracked. Use analytics software to monitor performance and adapt strategies based on results. Resources needed: quality metrics tracking tools, reimbursement educational materials, patient management platforms. The impact here: proactively adapting to value-based care models, resulting in steady reimbursements, enhances care quality, and improves patient satisfaction. Updating records for minor consent laws. Scenario: state law changes allow minors to access specific healthcare services without parental consent, complicating record keeping and confidentiality efforts. Steps taken by CMAA: Update patient management systems to distinguish between general and confidential services for minors. Train staff on consent requirements and confidentiality protocols under the revised law. Implement secure, separate files for services obtained without parental approval. Review billing workflows to ensure legal compliance and charging for confidential services. Communicate policy changes clearly to patients and families to avoid disputes. Resources needed: legal compliance software, minor consent law reference materials, secure filing systems. Impact: maintains compliance with state laws while respecting minors' rights, safeguarding the facility from potential legal claims. Another application example here we have navigating surprise billing laws. Scenario: new regulations prohibit surprise out of network bills, requiring upfront cost estimates for patients, an unfamiliar practice for the facility. Steps taken by CMAA: audit patient billing processes to identify potential out of network charges, implement workflows where patients receive upfront cost estimates for services detailing in and out of network coverage. Integrate software that flags out of network procedures in advance. Educate staff on clear communication with patients regarding billing policies and options. Monitor patient feedback to refine processes and improve satisfaction. Resources needed: cost calculator tools, patient financial agreement templates, insurance network databases. Impact: transparent billing practices reduce complaints and prevent legal non-compliance while improving patient trust. Coordinating ICD-10 annual updates. Scenario: annual updates to ICD-10 codes disrupt billing workflows, causing delays in claim approvals due to outdated codes. Steps taken by CMAA: distribute updated ICD-10 guidelines to all administrative staff, organize coding workshops to train staff on new additions, deletions, or modifications. Update EHR software and run test claims to identify errors in the system. Collaborate with insurance representatives to clarify changes in reimbursement policies affected by new codes. Monitor initial claims submissions to assess the effectiveness of applied changes. Resources needed: ICD-10 coding manuals, online coding workshops, comprehensive EHR electronic health record updates. Impact: ensures ongoing efficiency in billing processes, safeguarding the facility's revenue stream and maintaining payer relationships. Implementing ADA accessibility. Scenario: an updated ADA guideline requires additional adjustments in facility layouts to accommodate disabled individuals. Steps taken by CMAA: conduct a facility assessment to identify non-compliant areas, collaborate with contractors to install accessibility features such as ramps, signage, and handrails. Audit public areas to ensure the challenges meet ADA guidelines. Educate staff on assisting disabled patients respectfully in line with ADA standards. Ensure documentation clearly outlines compliance with accessibility improvements. Resources needed: ADA compliance guidelines, construction and design templates, accessibility audit tools. The impact here enhances patient inclusivity, avoids legal repercussions, and elevates the organization's reputation as an accessible care provider. Drafting public health emergency policies. Scenario: a public health emergency like a flu outbreak requires immediate adjustment in vaccination protocols, including prioritization and reporting. Steps taken by CMAA: develop a temporary vaccination workflow to manage high patient volumes, ensure inventory monitoring tools track vaccine supplies in real time, create clear schedules to optimize staff availability and ensure adherence to public health policies, report vaccine administration rates to the local health department per emergency guidelines, conduct after-action reviews to improve future emergency responses. Resources needed: inventory tracking software, CDC vaccination reporting tools, emergency response frameworks. Impact: prepares the organization to handle public health crises efficiently while safeguarding the community's health and meeting regulatory expectations. By Expanding on these applications, learners gain a deeper understanding of the real world complexity of healthcare law and policy and how to master administrative responses for effective compliance and patient care outcomes. Next, we have the summary tables. Table on key compliance requirements in healthcare administration, table on privacy laws and their administrative applications, table on billing regulations and their application, table on practice management adjustments for legislative changes, table on real world administrative applications of healthcare law. Next, we'll revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. What is the primary purpose of HIPAA compliance in healthcare administration? A. To lower the cost of patient care. B. To ensure patient health information and PHI is protected. C. To standardize billing practices between facilities. Or D. To prevent disputes between staff members. The most appropriate answer is B. To ensure patient health information PHI is protected, as HIPAA is specifically designed to regulate how PHI is shared, stored, and accessed to protect patient privacy. Question 2. Which of the following is a key administrative step when addressing a data breach according to HIPAA guidelines? A. Ignoring small breaches to avoid legal complications. B. Notifying affected patients and securing vulnerable systems. C. Deleting all compromised data to eliminate threats. Or D. Firing the IT administrator handling the breached system. The most appropriate answer is B, as HIPAA breach notification rules require informing patients and taking steps to prevent further breaches. Question 3. What is the primary concern when implementing minor consent laws in healthcare administration? A. Ensuring the minor is aware of all billing processes. B. Confidentiality recording and billing for the minor services. C. Reporting all minor-related services to their guardians. Or D. Limiting services for minors to avoid legal issues. The most appropriate answer is B, as administrators must securely record services and handle billing in compliance with laws ensuring a minor's confidentiality. Question 4. What is the critical step in adapting to value-based care models as described in practice management adjustments? A. Improving patient outcomes to meet quality metrics. B. Increasing the number of appointments per day. C. Reducing expenditure on patient care. Or D. Avoiding quality metrics metric evaluations for financial savings. The most appropriate answer is A, as value-based care focuses on patient satisfaction and outcomes, tying reimbursement to these factors. Question 5. When applying the False Claims Act FCA within billing practices, what should the administrative medical assistant focus on? A. Upcoding services to maximize reimbursements. B. Keeping detailed documentation to justify all claims. C. Billing for services not rendered to ensure steady cash flow. Or D. Submitting claims without verifying coding accuracy. The most appropriate answer is B, as proper documentation ensures that claims are accurate and in full compliance with the FCA, reducing liability risks. And here we come to the end of this lecture. Thank you very much and goodbye.